genetics is history, and to know the background of your bloods and find out what's in your genes. And so we need some education, awareness, information, and to come and talk to us about it and let us know how it works and what happens.
One thing is that in our community, people were a bit unhappy about the idea of genetic testing, because in the past things like that have been used to say that Aboriginal people are inferior in some way. And with all the information in the news about genes and ancestry DNA and all these other things, people are a bit afraid of that the testing might be used to make Aboriginal people look bad. And so that was something to address and to talk about, that this is about this individual child or adult, not about a population. So that was something that needed to be discussed openly and in the community.
In the communities, there is no services like that. You have to fly someone out into the city, the nearest city, to have the genetic test done. Sometimes I reckon it's up to the client how they feel, really, whether because as I said, there's shame and blame involved. Mainly shame when it comes to dealing with a balanda, which is a white person, a professional person which is not familiar with. It's scary for people when they come into Darwin and not seeing, not a familiar face, and too much information is given. Some of the clients don't like it when you bring interpreters, because they don't want that shame, they don't want that information to get out. So that's when family is important, and family who, like for myself, as a family support worker for MJD, they rather request for me than an interpreter, but because I'm a trained interpreter and I'm credited.
I guess there's some really simple things that we can do about making clinical genetic services more culturally appropriate. First of all, to improve the ways in which they engage with communities, by increasing the Aboriginal and Torres Strait Islander workforce, and by developing Aboriginal and Torres Strait Islander governance in clinical genetic services, so they can draw on the strengths of the communities where they work. But most of the issues that were identified by people in the Better Indigenous Genetic Health Services project were really around the preparation and support that people got coming to appointments, and also the support they got when they left appointments and returning back to communities, and really understanding the implications of some of that for their families.
I think barriers are probably going to be unique depending on where the person's coming from. So I think if you're thinking about barriers, you're probably talking with people to identify, one, what those barriers are, not just assume that the barriers faced by a particular person of a particular ethnic background from a particular community, which may or may not be regional, rural, remote, very remote, or metropolitan, not just thinking that that story fits everyone, that those barriers are the same for everyone. I think what's probably the most important thing to do in terms of addressing or identifying those barriers, and then coming up with solutions that actually empower people to actually have better access and equity of access, is to start conversations with the champions in those spaces to identify the barriers and then collaboratively come up with solutions.
Getting to meet families, not just the client, meet the whole family, because family is really important, because they have to be there for one another and support a client that's struggling with any disease. Flexibility, because they can have other impacts on their lives, and sometimes with MJD people are tired, and you need to be able to say, look, can we come and see you? And if they say no, you have to understand, because they are struggling. And you have to talk to them and making sure that they're happy when it's a good time for you to see them. And maybe also is not changing too many professionals. Keep changing. If one familiar professional is looking after a client, then it's better because they don't have to repeat themselves to another professional all the time. But if we have the one familiar face, that makes it better for them to communicate better.
I, as a Wiradjuri woman, and you got, for me, it's a different. We've all walked a different path, and it's quite complex because we don't only have, like in the population, if it doesn't matter if you weren't born here, if you turn up from another country, you're made an Australian citizen. But prior to colonisation, we had a lot of different nations, over 260 nations, and I can't speak for another nation, and they have different ways. So we need to learn how we deal, and it needs to be on ground, and they need to be the ones that say this is how our protocol is, and the health profession need to work and learn that, how they deal with people. If we can start speaking openly in public what genetics is about and how it can help, I think there will be a vast, well, hopefully there'll be a bigger uptake of people using the services, because it can really change somebody's life.
I think communication is the biggest thing that needs to be conveyed and understood. Although it's a bit of blood coming out, there's lots of stories in this blood. It is your mother's story, it's your father's story, it is your grandparents' story. I love to talk to my clients because that's where you get your information, and by getting that information you can help them. So regardless of anything that you do as a job, if you have that information, there is so much you can do to help. When I finally do get them to doctors, it's really, really wonderful and rewarding, because I can sit there and I can advocate for them, and because I know why they're going to be there, I know what they're going to come out of it with, so I can be there for them and support them.
We have to go and take them to a doctor and get that in a story, like deeper down inside. They need to feel comfortable with who they got there, their families there, they're working with them, and confidentiality side is kept between the families. It's not going elsewhere, so they feel really comfortable with us, and then that's how we get to get a good understanding of how we can help our clients.
Normally, we go to a funeral every Friday. The average life expectancy of an Aboriginal woman of Annette's peer group in our area is about 40. And so if there's anything that we can do that helps to understand and change that, it's really important. And understanding the importance of genetic diseases, not just the obvious ones like we see in childhood, but cancer, heart disease, diabetes, all those things is going to be really important and help to change outcomes for people. If you know your risks in time, then you have a choice. You can do something about it.